Hi, my name is Anne Marie Newman, and I'm going to talk a little bit about being a skeptical patient. And just for my brief background, I'm currently working in my third job doing medical records. I've worked somewhat in medical labs. I've worked at the front desk. I've worked in medical records. I've worked in release. So a lot of the stuff going on behind the scenes that doesn't involve doctors. And the reason why I think this is relevant to skepticism is that, to me, skepticism is about using science to base your decisions, about having evidence, about just generally making better decisions based on evidence and truth, not what we wish what we wish things were. And so I think that understanding the situation of your health and understanding your medical history gives you that evidence and leads you to make better decisions that can really help save you time and money and, most of all, anxiety. Okay. So, so common mistake is that HIPAA is not HIPPO, and it is not spelled with two P's, but HIPAA is the Health Insurance Portability and Accountability Act of 1996. It basically describes what sort of things are covered by the law and how they can be disclosed, under what circumstances. It applies to your insurance companies, your doctors, the people who might be processing records for various processes within a hospital. It doesn't usually apply to legal things, so that gets to be a different issue. But it covers all the documents, bills, conversations, everything you have, and it especially covers a lot of things that might be sensitive, like HIV status or psychotherapy notes, and keeps that kind of information from getting out to people you might not want to know. Under HIPAA, one of the main key phrases is minimum necessary, that you really want to give out as little information as possible to do what needs to be done. If a health department's doing a study about how the flu season is going, they're not going to get records of the time you broke your wrist in the ER, because that's not relevant. If a lawyer wants your record, unless they specify bills, we're not going to give them bills. And it also covers a lot of your rights as a patient. Your records are yours. You have a right to see them and get copies. You don't have a right to have the originals. You have the right to have corrections added. They won't change your record, but you have the right to have things added to it. You can have a doctor explain something where they might have made an error, and if they disagree, you have the right to explain yourself and have that letter put in your record. And it means that you must be able to know what your records are being used for and consent to many of the disclosures that may be done with your records, essentially. And it gives you the right to report any violations you see. So if you feel uncomfortable about something, you can go to the HIPAA website, which is on the Health and Human Services Department of the government website, I believe. Okay. So I just want to talk a little bit about keeping your medical records. How many people in this room have at least one doctor? How many have seen at least two? Okay. So pretty much everybody. And the chances are that if you're trying to get your records to all the different doctors you see, it's going to be really difficult. One doctor might get the results from one test because they ordered it, but the other one doesn't get it, and they might need it for that. So it's a really good idea to keep a set to yourself so that you can bring it to new doctors, so you can get a second opinion easily and in a timely manner. And it means that you'll have the copy of what happened, even if the doctor tells you when you're upset or forgetful or might misread it, it means that you'll have the copy that tells you exactly what happened. One case I saw was a patient came in requesting records on a certain blood test, and they were given a number that didn't really make a lot of sense. And when we went in and checked, it turns out that they were being given some sort of chemistry when they were expecting a different kind of chemistry, and it was part of a legal matter, so it could be really vitally important to have the right numbers there. And we were able to catch it because we printed it out and gave it to the person. If you just read it over the phone, that person might get a totally false perspective of what their situation is. It's also important to know what the numbers mean. If you're getting your cholesterol checked and you hear 300, you should know if that's good or bad. If you do a blood alcohol concentration test, you should know that 0.5 means you're probably not even aware that you're being told what 0.5 is. And I would suggest, this goes along a lot with what Michael was saying, that you might want to keep a record of your allergies, medications, problems, and procedures that you can take with you to doctors and keep updated, because it's really easy to forget, especially when you're at a doctor's office. And in one study with elderly patients, they found that on average they had 6 medications that they were taking, and 48% of the people omitted at least one when reporting their medications. And when there's, especially with when you're taking multiple medications, if you have one medication that is a fall risk, the more medications you add on, every single one increases your fall risk. So not knowing that could make a major difference. Adding a drug to that when they don't know one you're already on can make a huge difference. So it's really nice to have on paper where you're not going to be frazzled or frantic. And another thing that can be really helpful with that is bringing a list of questions with you to the doctor so that you don't get caught up in what's going on and you can know what you want to know and have it prepared. Okay. The internet, okay. Okay, so I'm going to show a clip. This works.
Hi, I'm Dr. WebMD. Can I have your name, please?
Jake?
And your email and zip code. They're optional. Great. So what brings you in here today?
Well, you're free.
Too embarrassed to see a real doctor?
You got me. What is it, Doc?
You have cancer.
How could you possibly know that?
Oh, I tell everyone they have cancer. Why? What seems to be the problem, besides the cancer?
I've been going to the gym more lately, and the upper part of my shin really hurts.
I don't know anything about that.
Oh, okay. What if I just say my shin hurts?
See? Told you. Cancer.
I really don't think I have cancer.
Nobody ever thinks they have cancer. The symptoms can take many different forms, such as throbbing in head, runny nose, mild cough, stress, or one of 14 other things. Do you eat vegetables?
Yes.
13 other things. But I have to tell you, 8 of them are STDs.
What should I do?
Xanoplex?
Jesus! No.
Tell you what, I'm gonna write you a prescription for 10 tips on how to have a healthy summer. Don't forget to bring a beach ball. See my nurse on the way out. She can recommend some great beach ball clinics on the west side.
How does that help my shin?
For a more complete examination, please see a doctor.
What are you?
I really think that you should use some Xanoplex. You just take a small dab, rub it on your belly.
Enough with the Xanoplex.
Sorry about that. They're one of my sponsors.
You know what? I'm leaving.
And who are you gonna see? You don't have health insurance.
I guess it starts acting up mostly when I'm going up the stairs.
It's definitely AIDS.
Okay, so obviously, using the internet can be very problematic for trying to figure out what's wrong with you. Don't self-diagnose. Don't go to the WebMD symptom checker and just go through it and convince yourself, because a lot of times you're not going to get the full picture of things. If you go in there and you say that you're having severe pain in your the lower right part of your stomach, it's going to probably tell you you have appendicitis. But if you don't have a fever, if you don't have any other symptoms, you just kind of have a sore stomach, it probably isn't. So that's the kind of thing you want to talk to with a doctor, not just try to diagnose yourself. Most doctors, in my experience, are fine with you doing research. They're not going to get mad because you look things up online. But I would say stick to sources like Medline and the Mayo Clinic. The U.S. government has one called Health Finder that is a good source, and a lot of the sort of things from universities and medical schools. But it's something you want to really defer to a doctor's experience. And if you don't feel comfortable with one doctor, get a second opinion, but don't get stuck into the trap of diagnosing yourself with something and then deciding that that's the end-all and be-all and just searching for someone to tell you you're right. One good thing that is really helpful to look for online is terminology. If you want to learn more about something you've been told you have, it can be really helpful to look up things that way and look at the terminology. One problem is in talking to patients is jargon. This is an example I found of plain language that I thought was pretty funny. So, one sentence I found in a pamphlet was, a low level of physical activity predicts both a greater prevalence of cardiovascular disease, morbidity, and mortality. So how many people understood that easily? Okay. Half of you, and I would say we probably have a pretty smart crowd. Basically, it's saying that if you don't exercise, you're more likely to have heart or lung disease and even die of those. It makes a lot more sense to tell patients that, especially if they don't have particularly high levels of medical literacy. I know, like, a lot of times in groups we tend to use jargon. Probably a lot of us have said, oh, that's pareidolia, or oh, that's the idiomotor effect, and we have to realize that not everyone's going to understand our jargon. So coming from the other side of things, ask questions, have them dumb it down for you. They're not going to be mad about that, and it makes things a lot easier if you understand, and it's not a matter of looking stupid to not know some technical term. Okay. Pseudoscience. One of the things I found is that a lot of places seem to have, especially in the cancer oncology areas, there tend to be a lot of pamphlets and things. I think a lot of places want to offer options, but there's not always a lot of options, and I don't know how well things are vetted, whether they go through these pamphlets, whether they're checked. And some of them may be harmless and some of them may be relaxing, but some of them aren't. And being at a doctor's office doesn't guarantee that the doctors have checked it out or it's a good idea. I've seen acupuncture, Reiki, diet, positivity, reflexology, all of those push towards cancer patients from pamphlets that are around, even if they're not being given out directly. The only pamphlet so far I've found that really addressed the issue and brought up pseudoscience and brought up alternative medicine and actually addressed it and said what the problems were was the American Cancer Society pamphlet. But I would say if you see things like that, ask your doctor about them. It can be a good way to get a perspective on how your doctor sees things, whether they're more science-based or whether they might tend towards alternative things, and complain. If there's problematic stuff, complain. Tell them you don't like it. And finally, it's around flu season every year. There are pushes in healthcare to get people vaccinated, and there are a lot of excuses from the healthcare staff. I've been told that I get the flu every time I get the vaccine, and I'll say, well, it doesn't really last 2 weeks, does it? I mean, the last time you had the flu, it really knocks you out. It's like weeks of pain. You're missing tons of work. If you kind of felt sick for a day, that's not quite the same thing. But my favorite response was, I was told that just use onions. I was told that you put out a bowl of onions, cut up onions, put them out, and that will keep you from getting the flu. And if you get the flu, you just cut up onions in your socks, and it will draw the fever out. I'd never heard this. I was doubtful, so I went to Snopes, and I found that it is a 111-year-old at least myth. The only things I could think of was maybe people on onion farms are far enough away from other people not to get diseases. Maybe if you have a lot of onion on you, people aren't going to get near you and give you the flu. But it's not a great plan, and so I just wanted to say that just because someone's in healthcare doesn't mean they're an expert. There's a lot of positions that don't require expert knowledge. A lot of the people who do have more medical knowledge have it because they've really made an effort to learn it. Everything I know about medicine is probably from college and my own interests outside of the classroom. It's not coming from the job. So people are as prone to myths and pseudoscience as the rest of the public is, as the patients are. So I would say take charge of your own health and make the best decisions you can, and just recognize that there's still pseudoscience you have to look for and fight through when taking care of yourself. Okay. Questions?
I totally agree with scientific medicine, but I was wondering, in your perspective, is there any merit to holistic medicine?
A lot of the stuff that's called holistic, one of the quotes I like best is, what's alternative in alternative medicine isn't really useful, and what's useful in alternative medicine isn't alternative. If you go to a doctor, they're going to tell you to exercise. They're going to tell you to eat right, generally. Most doctors are going to give you that kind of advice, and those are great things. People will talk about meditation and mindfulness and things that can really help your mood and be good overall things. I've had a doctor say that they prescribe to patients exercise. They say, take this as seriously as you would the drug I gave you. I'm prescribing you exercise. Exercise is really good for you, and it's something that is pushed in pretty much, I would say, most arenas. There aren't too many people who are anti-exercise, at least as a rule. They might be personally. So that would be mine. Okay.
Do you think exercise prolongs life?
My impression is that there really haven't been any studies showing that exercise does anything wrong for you. I mean, and I believe it does help cardiovascular health, which can prevent a lot of earlier death and symptoms.
Exercise physiologist here, and yes.
Thank you.
Your life, your mental status, I mean, everything about it, it's shown that older people who keep exercise regimens up have lesser prevalences of dementia, of Alzheimer's, I mean, pretty much everything bad that can happen, exercise is a pill. Where did you get it? Where did you get that study? I mean, you can look in any basic exercise physiology journal, Nature. We just put I just had a paper published in Cell Biology that it talks about it's very technical, but it's a lot of stuff going on with your heart rate, your heart health, your heart. I mean, I think you can talk about that. Yeah. They connect that with muscle memory. With muscle memory. Well, what's your question? I'm sorry. Do you know of any studies that connect physiology living longer with muscle memory? With muscle memory? Memory or just muscle?
No, muscle memory.
Memory, I mean, the brain is not the only thing that has memory.
Right, that's true.
The brain isn't the only thing that has memory, that's true. I mean,
I guess is the question essentially that maybe working out might help your heart get in better shape and keep doing what it's supposed to, maybe like that kind of muscle memory?
I mean, that's absolutely true, yes. Well, I guess I'm kind of not, I want to answer the question that's being asked, but I'm not quite sure what it is. Well, I think human beings have been dying half because of that muscle memory. At halftime? At halftime, yes. Well, I think if you do a muscle memory thing, then your average life will be 160 instead of 80.
Well, a lot of problem a lot of problem is that we do have a lot of things that show up around the 80s that we haven't been able to get past. A lot of times Alzheimer's will hit, cancers will hit. Essentially, if you live long enough, you'll get cancer.
And there is, as far as living that type of life, there is, you have environmental factors of aging, but you also have internal factors such as DNA breakdown. Your, the ends of your DNA basically break down to a point where they can't make your proteins correctly. And that's where a lot of problems with older people come from.
You know, when people grow their teeth in the old age, they used to live to 22, 24. And then when they know how to not break your teeth with the bread, the average age went up to 44.
Right.
And then when they found penicillin, the average age went up to 88. I really,
Okay.
I'm not sure I think that's right.
Okay,
I
think we have to cut it off there.
Extremely higher age ranges we see are lower infant mortality, not lifestyle.
Well, there's a lot of different impacts, and I would say also the idea with the telomeres that was brought up is one of the problems with the telomeres is I think there was a recent study that found that people who don't have the breakdown of telomeres are more prone to cancer. So there's always kind of the borderline. If you have a really poor immune system, you're going to get sick a lot. If you have a really active one, you could have lupus. So you got to balance things out and don't want to kind of stay in the middle.
I'll steer this in a different direction, and we didn't prepare this ahead of time, but so you mentioned we're calling up and asking for their medical records, and then there are things being read to them over the phone. Can anyone do that? Can anyone ask for my medical records? How do you know it's me when I call? What are sort of the rules around that?
Okay. Generally, no, we wouldn't just call, and I don't actually give out any information over the phone other than asking people about what they want and things. But what we do is we check signatures against photo IDs on file. If people come in, we check their photo IDs, we make sure everything match up. They need to provide their name and date of birth or social security. Really big on checking at least a few forms of identification because we don't want that to happen. And sometimes people get mad, they don't want to show ID, they forgot ID, they want to pick up their spouse's records and don't understand why we can't let them. But that's sort of the price you have to pay in convenience to have your records be safe and private.
What about something like if I need to know when I last had a tetanus shot? Can I call that in, or would that also be I have to go in person? You
could probably, what I would say is you might be able to get that. It would vary on the place. I think some places will tell you. It would kind of depend. If you called your doctor, they would probably be able to tell you. But where I'm working, that wouldn't really happen. What we would do most likely is either offer to mail it or fax it. And we can't email. Email is not yet HIPAA approved. I think some systems may be, but yeah. Oh, last one.
So this is really random, but I want to kind of compare it to your knowledge. So on this episode of Law and Order, there was an individual who stalked this woman, and he supposedly the story, he went online, and I mean, he found an agency that looks up information on individuals, and he had all types of crazy records that you would assume that he should not be able to get a hold of because he wasn't that individual. And so from your knowledge of how much information is out on the internet to what I could personally get on anyone in this room, how does that compare to?
From my experience in the places I've worked, none of it's online unless you could, I think you would have to, there's a lot of security measures. You have to be using the right computer, you have to have the right system installed, you have to have the right passwords. As far as I know, I haven't heard of anything where any of the places I've worked with people getting in that way. It would probably have to be old-fashioned forgery or something like that. Social engineering would be a major thing, which
for the right price, you could probably get a lot of information.
That's possible, but a lot of things too. Of someone could, if you had a person who wasn't going to be completely following the rules, they might push and say, "Come on, I'm her spouse. She's sick. I really need to get these to her doctor," and it's being able to resist that kind of social engineering pushes and say, sorry, that's too bad. We have to follow policy because it's for everyone's safety. 3 minutes. Anyone? No.
Are there any regulations about how difficult they can make it to have your records faxed to you, or how much they can charge?
There are regulations on charge. I'm not sure if this is for, I believe the rules are they cannot charge you for a finder's fee for patients. And then it's, I believe the limit is about 50 cents per page up to 50 pages, 25 cents after that, and it can be $1 per page if it's microfiche, if you're going back that far for microfiche or films. But it would depend on the place. Some places charge more, charge less, and a lot of places, if you let them know that you want it for your continuing medical care, will provide it to you for free, at least the first time. So it's worth asking. Okay. I think we're good. Okay. Thank you.